disorder that is called split personality or multiple personality disorder, it is basically characterized by huge memory losses. The person experiences huge memory losses. He does not have an awareness of what he had done 2 days prior or what he had done 1 week ago, and so on and so forth. The reason for these huge memory losses is that the person has more than one personality. And it's something like that when one particular personality is active, the person has a very different life, different ways of feeling, thinking, different relationship, different hobbies, different interests and different passions. And when the person has another personality, there's a total different set of all these mental, emotional and behavioral components. The interesting thing about that is that the person lacks awareness. That is, one personality does not know that the other personality exists. And because of these things, the person experiences a huge discontinuity in time. He cannot recall so many incidents, so many phases, so many parts of the life lived. And this adds to a lot of confusion. People who are there around the person, in the life of the person, people who are very close emotionally to the person, they feel extremely weird about this, because when they ask a person about what happened 5 days ago and about some major incident in life, the person is completely blank. He denies it and says that I'm not like that, I never did it. And this creates a huge relationship struggle and problems, and the whole gamut of conditions that can be associated with. The causes for this very interesting disorder are extremely traumatic childhood. The childhood of a person with split personality or multiple personality disorder is characterized by traumatic abuse, usually sexual and physical abuse. And this abuse is not something that is there for one time or twice or maybe more than that. It is a continuous abuse, and the abuser is someone very close to the person. The abuser typically frightens the child that he should not express and not feel the pain and things that are associated with the abuse. Therefore, the child starts dissociating. It's a complete denial of awareness, complete denial of parts which experienced abuse. People with split personality or multiple personality, they need intensive psychotherapy, and they should be coming for that. Within the mental health field also, if you see various psychiatrists, clinical psychologists and doctors, this disorder is very debatable and people tend to take extreme stance related to this disorder. There are some mental health professionals who would be really moved by suffering of these people and who would say that this disorder does exist and it's a very painful condition which requires a lot of attention. There would be other doctors who would say that this is something theatrical, this is something false, there isn't something like that. In this entire thing, there are actually very few people who can actually understand what the person with a split personality goes through.